Welcome to the Alberta Prosperity Project podcast. If you're ready to listen, sit back, relax, and enjoy the show. Thursday, July 7th, 2022. Welcome to episode 9 of the Alberta Prosperity Project podcast. I'm your host, Hunter, today, joined today with Tanner up in Lloyd and Dennis in Edmonton. How's it going?
Oh, so for me, it's going fantastic because, and I'm sure Dennis is going to say the same, I'm excited because as you know, as both of you know, this week we are off to the Stampede, Calgary Stampede. And I haven't been to the Calgary Stampede, in years and years and years. And so we have a pancake breakfast that we're hosting there. We have a lot of people attending. Am I right, Hunter?
As far as I know, we maxed out on the reservations and we added another 100 seats. So if you want to come see Dennis flip a couple pancakes in a big cowboy hat and cowboy boots, you might want to sign up for that now.
Oh, not bad. And I'll be there too. And you'll be there too, right?
You bet. Absolutely. It's going to be...
Oh, yeah, we're all going to be there. Now, the
yes.
question that I have, first for Hunter, maybe for Dennis as well. Have you ever worn a pair of cowboy boots in your life?
Oh, that's an easy question for me because I've worn cowboy boots almost my entire life.
Okay.
So,
okay, not bad.
Absolutely. Exactly. I've got dozens of cowboy boots. I have little trouble getting into them these days because of a foot problem, but that's more recent. In any case, but you mentioned the Stampede. Tanner, you said you hadn't been to the Stampede in many years. Well, the last time I was at the Stampede is more years ago than your two ages combined.
That's not bad. Yeah, you got me beat then. That's not bad. That's a pretty.
I think it was about 12 or 14, somewhere around then.
That's
14,
a large
15.
metric. Okay. Well, so it'll be an exciting experience for all of us. Hunter, I don't think you've ever worn cowboy boots, hey?
I've tried them on once. I looked way better than you did, so I wanted to give you a break. I'm sure Danny, that's where that ended
true.
up. But
that's not true. I used to haul grain once in a while, and the style for hauling grain with Super Bees is to wear cowboy boots. That is like the style. Now, I made the mistake of wearing them once when I was cleaning out the inside of the trailers, and that was foolish because it's just smooth aluminum in there. And so I was slipping and sliding all over the place. I never did that again. But when I was just hauling grain, of course, because hauling grain is so fashionable to begin with, I simply had to wear cowboy boots. But at any rate, I'll have my hat on, not my cowboy hat, but I have a flat brimmed hat. I know some have seen it. That'll be fun. I'm excited. Stampede's going to be fun. So,
well, I gotta say, with respect to cowboy boots, it's really only real men who wear cowboy boots.
That's true, and they're comfortable. That heel, man, they're nice. In my opinion, I like that little bit of extra leverage. I think it's natural.
And Hunter, at some point, you'll be a man. At some point.
Yeah. I don't know if we want Dennis back on the show. I don't know about this.
Let's bring him back every week. I'm already a huge fan.
Yes,
I'm a huge fan. But anyways, okay, so what are we talking about today, Hunter?
Yes, so getting into it, I guess just to start off with, obviously, Dr. Dennis Modry has not been on the show yet with us. So do you mind maybe just going into a little bit of your background, Dennis, what you did before the Alberta Prosperity Project, and just give us a bit of history on you.
Sure. Well, I've had a long history in the medical profession and in training. So I did my medical school and undergraduate training here in Edmonton, and then I spent 8 years at McGill, training in general surgery and cardiovascular surgery, and then another 3 years at Stanford in high-risk cardiac surgery, immunology, and heart and lung transplantation. So that sort of gave me the credibility to come back to Alberta and start Western Canada's first heart-lung transplant program, which we started. I came back in March of '84. But we started the program in July of 1985, and it's been a tremendous 30-year career. It was a real privilege for me to be able to have the trust of patients, to operate on them, to improve their quality and quantity of life. And yes, it's been a great privilege, and I have to say I miss it, a great deal. In some ways, I wish I could dial the clock back and be younger. But something, it brings up a good point, and that's clock genes. Some of the geneticists have discovered clock genes, and at some point, that fountain of youth, by reprogramming your clock genes, maybe at some point, we're going to be able to become younger and younger, then of course that would raise the question, well, where would everybody live? So I guess you could answer that with Elon Musk, because Elon wants to colonize Mars. So maybe that's where the next set of people are going to go. Who knows?
There we go.
Who knows
Yes.
what's going to happen?
Absolutely.
But genetics is a fabulous field, and the advances that are being made there are pretty impressive. Any case, that's a little bit of my background, and one of the things I should say, with respect to that medical background, is it did give me some opportunity, or a lot of opportunity, to get inside politics, both in the Getty era and in the Klein era and the Stelmach era. So, so that's a little bit of the background.
Perfect. Absolutely. And that ties in well to what we're going to be talking about, largely on a broad scale, just about healthcare in general and what we're putting forward, and talking a little bit about what's happening right now. But just before we move into that, I got to know kind of what got you interested, I guess, in starting the Alberta Prosperity Project. You were obviously one of the key drivers to this whole thing. And so you could be, like you said, enjoying your retirement or back in the medical field, but it seems you want to hang out with Tanner and I. So I just kind of am trying to get a rationale why that might be.
Especially Hunter.
Well, the reason I started it was because of you two guys. There's no question about it. But apart from that, I mean, I saw what is happening to society, and it concerned me with respect to the perturbation of what built Western civilization in terms of values and principles. And I thought we were really getting away from that. And I also thought that it concerned me regarding what was going on with the inefficiency of government and the inefficiency of the healthcare system, of which I saw on a regular basis, and I've written about it, I've debated it publicly. And I just felt that there was an opportunity really for Alberta, with its tremendous natural resources, to be a leader in the world, not just with respect to the economy and showing others how things can be done, but also as a beacon of freedom and prosperity that other regions in the world can look to and emulate if they too want freedom and prosperity and better health, I guess you could say, on top of that as well. So those would be the major motivating factors that got me into the Alberta Prosperity Project, to be one of the founders. In the beginning, I was a member of the Wild Rose Independence Party of Alberta as a VP of Policy and Governance. And when I left the board, along with a number of other people, the question was, well, do we start another party or what? And it seemed as though it was more sensible to start an educational society, to educate the public about the benefits of and the rationale for Alberta to have greater control of its destiny. And in so doing, fundamentally protect individual freedoms, rights, prosperity, self-determination. And get out from under the control of the federal government and the socialist Marxist mandates that are being foisted upon us now. That many of us in this province, and I would argue the majority of people in this province, don't subscribe to. So I think that's a pretty good summary of how my interest evolved with respect to being involved in the development of the Alberta Prosperity Society and the Alberta Prosperity Project, which is governed by the Society. Yeah.
Perfect. Absolutely. And that, again, was a great brief overview just on why you got started and where we're going, hopefully. But I know that in your when you were talking there, you mentioned briefly the inefficiency that you saw in even our healthcare system. One stat that I looked up right before we did this podcast here is that we have an average record, I guess, across the world for having a 22.6 week average wait time for elective surgery. So do you mind maybe touching just on some of the inefficiencies in our healthcare system that you saw when you worked within it, and just how you saw that?
I mean, I'm gonna list off where the inefficiencies are. And they really start with the Canada Health Act, which prevents creative solutions to solving many of the problems that we have in our healthcare system. But the problems occur at multiple levels, and we are all responsible. Federal, provincial administration and governance is one area. Hospital administration and boards are another area. Physicians and surgeons are also responsible. Nurses, other paramedical personnel, including technicians, ambulance attendants, etc. Patients themselves are an issue. The legal profession is a problem. Poverty is a problem. Fraud is a problem. Wellness promotion, which hasn't been done as well as it could be, is a problem. And there are areas of medical research and teaching that really are really in a very large extent. You could take much of the research, for example, that's gone on with respect to developing COVID-19 vaccines, for example, and if you follow the money, you realize that a lot of the research that's been published, when you look at the methodology, you realize that it's invalid, but these people who are publishing these articles are being paid. And so even that in and of itself is a fraud. But some examples of the inefficiency that I experienced, and I can give you a couple from the perspective of a cardiac surgeon and my surgical colleagues as well. So for example, if a general surgeon has a case that is scheduled in the afternoon, and shift change for nursing and technicians, et cetera, occurs at 3:30, then it may be that the case won't go ahead if it's a 3-hour case, for example, and if it can't start till 2:00, then, for example, the case may be canceled because of the issue of a lack of personnel. So that means you've got personnel paid for an hour and a half, and in which a case could be done, but it would go over the 3:30 time limit. There was one example of many. One of the things that I found most startling in terms of inefficiency was we went to Cedars-Sinai as a group. You often learn from other centers what they do. And in our center, between cases, so I do an open heart case in the morning and an open heart case in the afternoon, and there could be an hour and a half period in which, delay between starting the second case. I guess that's the best way to say it. Well, when we went on a fact-finding mission to Cedars-Sinai, because we heard about their efficiency, we saw that the time delay between the two cases was in the order of about 3 minutes. And it was the way they did it. It was so efficient. It was really impressive. And time is money, of course. And it really got drilled to me when I was at Stanford one day, and I was the chief resident in cardiac surgery and transplantation. And I was dealing with an issue in the intensive care unit, and I was about 20 minutes late coming into the operating room to start a case. Well, boy, I'll tell you, the head nurse in that operating room tore a strip off me for being 20 minutes late, and made the point that you just cost this patient's family X dollars because you were 20 minutes late. So from an efficiency point of view, we're not very efficient. And I want to say that it's not that people themselves are inefficient. It's not that people are overpaid. They're paid fairly inappropriately. But the inefficiency in the system is just mind-boggling. And it's part of the problem why there's so much waste in the system. I mean, so much cost inefficiency. And we are the last country in the world, for example, to prevent competition in the healthcare system. And we all know that competition improves efficiency. And we're the last country in the world that prevents competitive services in the healthcare sector. And this is one of the reasons why the Canada Health Act should be removed and allow the provinces to implement the efficiencies that they think that they can accomplish. And then the provinces can compare between provinces what's working best and what's not working so well. And everybody improves that way. But we've disallowed, as a consequence of the Canada Health Act, we've disallowed competition in the healthcare system.
Mm-hmm. Yeah, absolutely. That was a great point, and I think I just want to touch on that a little bit more here now. And I'm assuming you're going to say the Alberta Prosperity Project is putting forward the idea that competition should be allowed in the healthcare system. But for people wondering, what would happen to, say, their Medicare and Alberta Health Services, which employs obviously thousands of people across the province? Is that all going to be dismantled in an independent Alberta, or how would that look for Albertans?
Well, I think people will find employment one way or another. So if we look at it pragmatically, Medicare should really be targeted to the vulnerable, to the people with low income, to those who find themselves disabled and unable to provide, a service to society from which they garner remuneration, or people who have been compromised by life circumstances and are unable to afford any form of health care. Now, there was a time when we had health care premiums, and that was one of the only mechanisms by which people knew that there was some cost to health care. But if you targeted Medicare funding just to the vulnerable, to the people who are disadvantaged by birth or at life circumstances, and they had a Medicare card, and then everybody else had, for example, a Blue Cross card or some other medical provider card that you then pay a premium for, you pay for, I should say. Then from the perspective of accessing your healthcare provider, you either provide a Medicare card or you provide a third-party insurance card, call it Blue Cross, for example, or Kaiser Permanente, or a Mayo Clinic card, something like that. And then you get your care. And one of the arguments against that kind of a system is that while all of the physicians and surgeons and nursing would move to a private system. Well, that doesn't have to happen at all. What happens is that whether you're working in the public system or in a private system, the service providers are all paid at the same rate. So you take away that argument. But here's one of the things that would happen. So, for example, in a Medicare system now, if, for example, a surgeon can do 3 hernia operations in a morning, well, in the private system, they can do 6 in the morning. What's the difference? The difference is efficiency. So what does that do? That compels efficiency in the Medicare system as well. So that eventually it should be that the Medicare system functions as efficiently as the private system, but you're looking after the system in different ways. And for a province that becomes a country that has very low taxes, then the savings to a family of buying a Blue Cross policy for their family will be far more cost efficient because they're saving so much more on their tax dollars. So as an example, if somebody was making $80,000 a year and they're paying $35,000 in taxation, well, if they only paid 10% of that, that's $8,000 a year in taxes, and they buy a Blue Cross policy for $5,000 a year or $3,000 a year, whatever the cost would be. Look at the savings. They're saving $35,000 right there, just in tax savings. So this is very doable. and it's very practical. But we don't have the efficiencies. We don't have the management efficiencies with respect to how our healthcare system operates. And when you have just a single care system, then there is tremendous amount of room for increasing the bureaucracy. And what I saw when I was in practice was layer on layer on layer on layer of management. So when there was an issue that came up, who was responsible, you can never find out who was responsible because it always went up and down the management chain. So there are opportunities here, but we've been afraid to tackle these opportunities or embrace these opportunities or look at them, with a real discerning eye and demonstrate to the public really how everybody benefits. And here's a stark example of the inefficiency of our system is the wait times. People waiting to get in for knee surgery, back surgery, neurological assessments, all kinds of assessments. This is really unconscionable in a free democratic society that business cannot play a role. Business principles cannot play a role in providing efficient healthcare services. So we have now, people will say you're creating a two-tier healthcare system. We already have a three-tier healthcare system. We have those people who are in the Medicare system and they wait for their care. Then there's another tier of the incredibly wealthy, incredibly influential, and the politicians who access their care ahead of everybody else, unbeknownst to the rest of the public. That happens. It happens all the time, and it's still happening. And then there's the third tier of those people who just say, to heck with it, I'm going to the States, and they get their care. And billions of dollars of expenditure goes to the United States and doesn't stay in Canada to create jobs, employment in the healthcare system here. So there's a tremendous opportunity. And this brings up the point that you were getting at earlier, Hunter, and that is, well, what happens to the employees that are working in the Medicare system? Well, they'll be a lot happier working in a very efficient private system where their compensation will be at least as good as in the Medicare system, but they will feel valued. And why will they feel valued? Because if they're not valued in a private system, then those employees will move to another private system. And that's the way it works. So there isn't going to be tremendous job losses or anything like that, but there would be maximal efficiency engendered in the system, and people who need their care will get it immediately, not the way it is now. I mean, if you know anybody at all who's ever gone to the Mayo Clinic, you find that, the care is provided instantly, which also brings up a unique concept of why not, for example, give the Mayo Clinic an opportunity to own and operate the major hospital systems in the province, or Kaiser Permanente, or Humana Corporation, or Hospital Corporation of America, or some Canadian corporation that could do it as well as a nonprofit organization. But they've got the controls in place for maximal efficiency. And we've really fallen behind the curve in protecting our healthcare or protecting the public via an efficient healthcare system. And the other thing that competition in the healthcare system provides is if one provider, for example, wants to insist that every patient in that plan has to be vaccinated with something that they don't want, well, then it gives them the flexibility to move to another plan as well. So in other words, not one plan fits everyone, which is the way Medicare operates right now.
Yeah, absolutely. That was a great explanation. And just quickly as well, I just want to pick Tanner's brain as well on this one. But from an economics perspective, do you think that these efficiencies that Dr. Modry is talking about, and obviously giving all these great points for it, does it make economic sense what the Alberta Prosperity Project is proposing, or is there something different that could be done as well?
Oh, no, it makes perfect sense, at least in my mind, because at present, and again, Dr. Modry can maybe touch a bit more on this, or he already has, we have a healthcare system where you have a group of, central planners at the top, where, as he was mentioning, you have layers on layers on layers, and they're trying to determine how to allocate the resource of healthcare, right? And that's not an easy thing, because some people have more urgent needs than others, or, some are in different positions than others, all are in different positions than each other. And so for a group of individual bureaucrats to come together like an oligarchy and then decide how budgets and resources should be allocated in markets like these, well, it makes no sense. It certainly makes no economic sense, right? And as Dr. Modry mentioned, you look at the wait times. Like, it's clear that we have a real problem with efficiency. And think of how many patients have died because they haven't got the care that they needed, or the adequate care that they needed, because they were on a wait list, or because someone else took their place, or some government official or some bureaucrat was able to get in first, et cetera, et cetera. And so we have a real problem. But when you decentralize, as Dr. Modry is talking about, and when you enable patients to more, not perfectly, but more accurately assess their needs and look at exactly what plan they need, and you introduce competition into the market, and you do all of these things that economics agrees with, well, then you're able to produce a more efficient system. Instead of having a few at the top who are determining how to allocate the scarce resource, you literally have millions of minds who are all acting in their own self-interest that come together because they're acting in their own self-interest. And then the market produces a much more efficient allocation of goods and resources. And so what do you think, Dr. Modry? This, to me, seems to be one of the main problems of AHS. It's just how top-heavy and bureaucratic it is, hey?
Well, let me give you an example of the way the budgeting works. So AHS, for example, will allocate a budget to a hospital, say to the Mackenzie Center and the Mazakowski Heart Institute. So it's one budget that comes in there, and then the administrators there decide how much money will be allocated to neurological services, to cardiology services, to general medicine services, to the various surgical services, to the ICUs, et cetera. So that doesn't make sense at all, because the way it should work is the money should follow the patient. And when the money follows the patient, then everybody gets looked after in a timely fashion. And there isn't these machinations. It's a competition. I mean, I was there, and you're competing for resources. So with administration, you're making your case for why you think you need more money, which might take away money that could have been allocated to another area in the next budget cycle.
Right.
So this sort of inefficiency is not a model that is used in business anywhere, because it doesn't work, and It's not working, and we're seeing the brunt of it not working. We also know from evaluations of our system that we function from a performance perspective in the lowest quartile of quality, but we're in the highest quartile of cost. How does that make sense? I mean, a quarter of our budget in health, in our provincial budget of some $60 billion a year, goes to healthcare. And there are opportunities not only to lower the cost, but to maximally improve the efficiency. And let me give you one example. If you had a private-public system working collegially, collaboratively together, you could have Medicare patients looked after in the morning and afternoon, and 3:30 it shuts off if that's the way they want to run things. But from 3:30 to the following morning, you could be running the private system. I mean, if McDonald's can run a restaurant 24 hours a day, why can a health system not do the same thing? And so the inefficiency of the system needs to be fixed. I coined a term when I was on the finance committee during the Klein era, and the term was called non-definitive healthcare expenditures. So these are expenditures that by evidence don't produce an improvement in health outcomes. So in other words, diagnostic studies and procedures, interventions, visits, whatever, that don't produce a benefit, why do we pay for them? And I termed those expenditures non-definitive healthcare expenditures because they don't definitively improve health outcome. But we're still dealing with this problem, and many others, of course. So, a government that really is by the people, for the people, really should be just that, for the people. And right now, the way Alberta Health Services operates, it is not by the people, and it sure as heck is not for the people, because if it was, then there would be maximal efficiencies and there wouldn't be people waiting to get into healthcare.
Absolutely.
Right.
Yeah, and that makes
sense. Sorry, I'm sorry. This is quick. So that makes total sense to me, and I like what the APP is proposing we adopt. You make it so much more efficient than it currently is. First, by decentralizing, by introducing these measures to cut down on the size of bureaucracy and enable doctors to actually practice as doctors want to practice. But maybe before we wrap up, Hunter, I just noticed behind Dennis this bear. Maybe we should show all the viewers this new bear that we have for APP. Dennis, if you want to hold it up, this has been my favorite merchandising product yet. Have we named him officially or no?
Well, we haven't, but I guess we could be open to naming him. I was kind of thinking of Little App. I've heard app. I've heard happy, like H with a, and then app, and then Y. I've heard a bunch of great submissions. So this is the newest APP merchandising. What would you call it? Well, he's great. I like him, the little Teddy.
Right. I think he'll have to come out to Stampede as well, to the pancake breakfast.
I think so. I think he'll have to be at Stampede. Yeah, I agree.
You know what we should do? We should have a family, where we've got one a little bigger, and we get to Mama and Papa Bear.
Yeah, I like that idea.
Mama App and Papa App.
Yeah,
that's right.
I like
that's
that
right.
Idea.
We can practice your medical skills, and you can sew them together, Dennis. We'll stuff some more with more stuffing, and you can sew them together. But just before we close out, did you have any final words for the listeners there, Dennis, or you were all good with that?
Well, I think, for the people that are listening to the podcast, I would just suggest to you that the opportunities for Alberta as an independent sovereign nation, the prizes are numerous. They're spectacular. No one is left behind, and it's exciting to think that what we can do if we all come together. And what, of course, to reiterate, when we as we grow the movement to 500,000, 1 million, or 1.5 million people, we will, for the first time in 116 years, control our destiny, control the destiny of this province, and control our own destiny with individual freedoms and rights, and let people live to make the decisions they want to make within the law.
Absolutely. Yeah, no, and that was wonderful. And like Dr. Modry just said there, if you do want to get involved in the project and join the growing movement of thousands and soon to be millions of Albertans, I encourage you to go to our website. It's www.albertaprosperityproject.com. It's there that you can volunteer, become a member, learn all about our policies and governance. We've got a more detailed plan on healthcare and education and all the major issues that we're seeing today, and you can check that out on our website as well. With that said, like we mentioned at the start of the episode, we will be at the Calgary Stampede on Monday morning. We're doing a pancake breakfast. That's at Ranchman's. So you can go to our website as well and RSVP for that. We'd love to see you out there. We'll make sure Dennis isn't burning the pancakes, and looking forward to that as well. With that said, though, it was great talking to you both, Tanner and Dr. Modry, and we will see the listeners next week. Have a great day.
Perfect. Thanks a bunch.
So thanks, guys. And thanks, listeners.